Today we're going to be talking about pulmonary function tests. The mainstay of such tests is spirometry, which helps to measure the volume of air that can be breathed out in totality or even over a period of time, and is useful for diagnosing conditions and helping to differentiate between obstructive and restrictive patterns. So we're going to be talking about the actual pulmonary function diagrams, and we're going to start off with the first one here that forms the basis. So key terms: total lung capacity or tidal volume, which is just listed over here, refers to the amount of inspiration and expiration in and out within a normal breath. Then you have more complex terms such as inspiratory reserve volume, which is just over here, which is the additional amount of air that somebody is able to take in with maximal inspiration. You also have the expiratory reserve volume, which is demonstrated here, which is the additional amount of air somebody is able to breathe out. Now, the main thing we're concerned with is something called vital capacity, which is a total of all three of these: total lung capacity plus inspiratory reserve volume and expiratory reserve volume, which therefore refers to the total volume with maximal effort that somebody is able to take in and also breathe out. So we move on to our next curve, which is a expired volume over time curve, and we use this to measure two parameters: FEV1, or forced expiratory volume 1, over forced vital capacity, FVC. Now, the main thing is that FEV1 is used to see how much an individual is able to breathe out and also how fast they're able to breathe out over 1 second. Peak flow is slightly different. That really assesses immediate obstruction and really thinks about time. So we're not going to really use this for diagnosis, although it's very helpful when it comes to establishing severity of disease, such as in asthma. Forced vital capacity is the total amount of air that can be expired over a single breath. The combination of this gives us a ratio, and really it's this ratio that gives us diagnosis. So in obstructive lung diseases, we have a reduction in FEV1 over FVC ratio, whereby the FEV1, the forced expiratory volume, is reduced because of the amount of obstruction that is there within COPD patients, asthma patients, bronchiectasis patients, and cystic fibrosis patients, whilst the total amount of air they can get in remains exactly the same. In restrictive lung disease, you have a reduction in FEV1 and FVC. So you have a restriction in the actual ability of the lungs to expand. So not only can they expire less air within 1 second, but also the maximum amount of air they're able to expire over time is also reduced. And that's it really. So see you next time. Thank you.